Okay, well, good morning, everybody. We'll make a start. We're expecting a few more people. I will do my very best to keep my beady eye on the waiting room and let people in as they arrive. So first of all, a big thank you from me for coming this morning to this week's edition of Wednesdays Weekly. This is a really, really important session and one that I know most people in this room are very passionate about, including myself, which is around Oldham developing a new vision for its children and its families, and improving the lives of children, young people and families. So, you know, a really, really important session to have you here and to hear your views and for you to be involved really in developing what the future vision should look like for children, young people and families in Oldham. So, you know, first of all, a big heartfelt thank you from myself for giving you time. I know all our time is very precious. But without further ado, really, I'm going to hand over to a colleague, Richard Selwyn, who is going to kind of lead us through this session. So Richard, over to you.
Thank you very much, Laura, and hi everyone. Really lovely to meet you. Hope I get to see faces and things in a minute. But yeah, lovely to meet you. And as Laura was saying, big thanks for your time. Really appreciated. And one of the rules I'd like for today, if that's all right, is that we interrupt. So just interrupt me as we're going along, and shout stuff out, give me ideas. What we're doing at the moment is trying to pull together a new vision for children and families. That the reason for doing that is because you'll be as aware as anyone else of huge amounts of change that's gone on. COVID pandemic over the last couple of years, big changes in how services are organised, lots of challenges in terms of how we meet needs with additional complexities coming through, and more children, young people needing support at the moment. So this is the right time to be setting a new vision, and we're trying to think through kind of what would things look like up to 2030. So this is not a kind of short-term thing. This is a how do we pull the whole system together over that sort of next 8-year period, and make the biggest difference for Oldham families. So that's kind of the setup. We've got sort of 6 questions. So I'm hoping it's a relatively simple idea. Jamboard's brilliant idea from Laura, and please put comments in. Just it's so helpful, pulling together a vision to be able to use the different thoughts and put that into what we're writing. It's really live at the moment. I've been working on it this morning, the vision, and I've got some things which I'd like to share, slightly confidential. I know we're recording, but hopefully the people listening to the recording don't share everything. But yeah, if I can share stuff, then that's just really helpful for me to be able to test things out, see how they resonate, and get some live sort of changes that we can make to the vision as we're going through. I think it'll probably be another month or so before we've got a kind of draft that we can start to circulate, but that's the idea. So if we go on to the first question, so we just wanted to know kind of, what should a good vision look like? What's the sort of format we should use? How should it feel? How long should it be? I've written a strategy recently around mental health, and the previous one was 65 pages of 11-point type all down the page, and it was quite tricky. So trying to make something shorter, more punchy, more accessible to people. But what do you think a good vision should look like?
Can I go first then, in the spirit of wanting to open up the discussion? So I feel really strongly that a vision for children and families should mean something to the people that it's about. So I feel very strongly that the vision and any plans or any strategies that fall from the vision should be written in a way that are meaningful for families, for children and families, and that are not a kind of a jargonistic in professional language. So that's the first thing that I'm going to put out there.
Yeah, it's really easy for the bureaucracy and how we organise services and everything else to take over, isn't it? And it's that needs needs some challenge, I think, in order to get us on the right page.
Can I add something? I think the vision needs to be ambitious, motivational, quite brief, but something that people recognise as something they're working towards. And then the detail needs to come later, doesn't it? But the vision needs to make people feel good. And as Laura said, it's understandable and recognise it, but it needs to be quite brief. If it's long, we lose people right at the start.
Thank you, Steph. I think that's a really good point. And it's kind of how you engage people and pull them into working together. That's what we need to do. Yeah. Anyone else? Steph, I can see it right now.
Just, I think it needs to have ways that we all try and build in children and families' input right from the very beginning and kind of know where it's going. And when we get views and input from them, we tell them what it's for and how it's going to be used and when they'll hear about it again.
Yeah, thank you. I think it's partly because of compressed timelines and stuff. I think we haven't been particularly good at bringing young people in. We have done lots of engagement work in advance. So we've got the Make Your Mark engagement work. We've got some other bits and pieces as well we've done. And we're partly around sort of developing the Oldham plan as well, which is all we're trying to knit everything together at the moment. But I'd really like young people to be helping to shape this and you know, almost editing it a little bit as well, but we'll see how that goes. I'm trying to get a session with the youth council at the moment and children in care as well, but yeah, anyway, there's some bureaucracy that gets in the way of these things, timing and everything else. Anyone else? What have you seen that looks good? Any examples?
The example, if I can come in, so the example that I really like, I don't know if other people have seen the Leeds child-friendly city stuff, which, you know, I think I've seen the stuff. I've been over to Leeds and had a chat in a previous role with them. And the thing about the Leeds child-friendly stuff is that it permeates absolutely every bit of the of the city. So if you're a taxi, you'll jump in a taxi and there'll be a sticker saying, you know, we're part of Leeds, we're child friendly, we're part of Leeds child friendly city, and children are really important to us. So it permeates everything, not just, I guess, council services or commission services or kind of our bit, you know, community activities and support services for children and families. So it genuinely is everybody's business, but the time has been taken to think about, in everything that is done in a place, to think about what that means for children and getting the best for children, young people and their families. So I really like that model.
It sounds like something that, like, you know, it's easy to get behind, isn't it? People can connect with it very quickly and easily, and that's what I was thinking when we were talking about what does a vision mean. It needs to be something that, you know, people can understand quite quickly and feel that, you know, like, yeah, why wouldn't you support a child-friendly city? And then, like, it gets you thinking about all the different ways that you can make it that, doesn't it? So, yeah.
I think that's right, but I think it needs to be believable as well. So I think, you know, people don't see it and go, yeah, what does that mean for me? You know, they actually believe it and can see sort of evidence of things changing to be real for them, and that it makes them feel part of it and not just something professionals are doing for.
I think achievable and believable, that, you know, they see that vision, and that everybody, whatever their role, whether it's as a practitioner, as you say, a service, or whether it's an individual, you know, whether it's that young person, they see that it is something that can be achieved, and it is something that they can believe can be achieved as well.
I think that's a really good point, Helen. Thank you. I think the child-friendly Leeds thing is really interesting. Partly, I think, yeah, you're right. The tagline's really good, and it's kind of a UN tagline as well, which helps. But I think the vision's part of it, but it's then how does it get put into everything else as well. So I'm really keen that, say, the Oldham plan, for example, has children as a really kind of core part of it that goes through the Oldham plan and things. You know, and again, you know, there are competing priorities for things, but Councillor Chatterton's been, you know, very positive about that, so that would be really helpful if we're able to stitch that in. Okay, should we go on to the next question? What outcome and priorities would we like? So if we go on to the next slide, I think this is an important one. So clearly we can list a load of outcomes and things, and we all do this, and outcome frameworks and whatever else. But like we've been saying, it's got to be meaningful, got to make sense. This is a new thing we've put together, which is trying to say, look, actually, what's the lived experience of children and young people in Oldham? What does it feel like growing up here? And then the diagram is simply, you know, if Oldham was a village of 100 children and young people, this is how many would be growing up in poverty, for example, at 38. So that's 38%. 75 would feel social media pressure. 75, 11 to 18-year-olds would feel social media pressure. 43 5-year-olds out of 100 have dental decay. It's these things which are actually, some of them are quite shocking. And then we put down the bottom that outcomes are not equal. In Oldham and places like Wearmouth have really high levels of poverty at 66%, and this is pre-pandemic as well. So I suspect it's harder. So something about, what are the outcomes which are coming through, and which we really want to focus on. How do we get everyone to really understand that lived experience of a child growing up in Oldham, and then how are we responding to the changes which have happened because of the pandemic, because of the impact of poverty and cost of living and things like that. Should we go on to the next slide? Just I think a couple of small bits I just wanted to share, and then we'll come back to the diagram because I think that's helpful. So some examples we could use. This is one which I think we've had before, about Oldham being stronger and safer and healthy and caring and ambitious and a great place to live and ambitious for Oldham. So you've got that kind of set of outcome priorities, a bit like Every Child Matters, but more developed than that. And then the next slide, got something from central government again, which is supporting families. So this is the subsequent programme to the Troubled Families Programme, renamed programme really, with 10 outcomes here. So things like getting a good education, reducing harm from substance misuse, financial stability, good early years, things you'd recognise, but a little bit more tangible, things which we can actually use on the ground when we're working together. And I'm quite keen we have a common language and set of outcomes. And then the next bit to consider is on the next slide. Now this is something I'm drafting at the moment, so it's a bit that we need to think through, and I'm keen to get your feedback on. Really, is trying to kind of highlight what are the really important things to pick up. So I've got 3 here which I'm trying out. One is around Better Together Oldham. So that's really emphasising how we need to work together, which is kind of the foundation of what we need to change over the next 8 years is that way that we work together across all the different services in localities, that type of thing. Second thing is right help, right time, right place. We've said it many times before in Oldham, but it's still true. It's about that quality of services. It's about the early help that we're putting in place. And it's about the district model we're creating. And then the third one is a bit of a new one, which is about celebrating our children and young people. And this is from really thinking through what Leeds are trying to achieve, and others, and what's our purpose here, and what are our values. And it feels like celebrating how well children and young people do in Oldham, celebrating along with parents about what we've achieved, what potential we have in children, is a really important part of what we do, and it really goes back to why we came into these jobs in the first place. So that was that. So I'm really keen on some feedback on the outcomes diagram, and feedback on the kind of what's important, 3 things which would be the sort of headlines of the vision if it became published like this. Okay, should we take the slides down and then see what everyone thinks? So, any immediate thoughts?
My immediate thoughts are, like Steph said earlier, around the vision being aspirational. I think when you look at the first diagram, all of the key stats are quite doom and gloomy. So it's very much around, I'd prefer a vision that is around that aspirational. So it looks at the positive and celebrating children and young people rather than homing in on tooth decay, this, that. I don't know that, but I think that should come later down the line rather than the big vision for Oldham, and that should be celebratory around our young people's achievements and young people having them play safe spaces to go to have fun and just to be young people. I think especially through COVID, young people just don't know how to have fun anymore, and we're trying to, excite and encourage. So I think looking at diagrams like that, especially from if I was a young person, for young people to see that would be a bit doom and gloomy.
Yeah.
I think.
There's a really interesting balance here. I think you've kind of really hit it. So some of the challenge we've got though is that some professionals aren't thinking about their bit of the system. They're not thinking of the full experience of the child and young person, and so that's why we have things like BCs, is it, or ACEs, that's it. So and things like that is because it's there to help the different professions to think from different perspectives, and partly about the child's experience, but also other professionals that are working with them, with the children as well. So there is a need to educate about what the level of need is, kind of what it's like growing up, and that we need to think about all these needs. But there's also a need to celebrate, and and not to, so yes, there's a tension. And I'd be really interested to know what others' thoughts are on that tension as well.
Just a thought, this is not a suggestion for words for the vision, but just thought if the vision was something about what young people should expect growing up in Oldham, so they should expect to be loved, cared for, happy, safe, fulfilled. And then why? Because actually that helps them develop and have a fulfilled adult life or something. So it's about the expectations now that we're all going to work towards. And I think happiness and care and safety and all that are all part of that. And then the reason is so that they've got a positive future and opportunities and things. Just thinking that through.
Yeah, thank you, Seth. Okay, any other thoughts?
I think there's something for me. I don't think I'm else coming in. There's something for me around thinking about that last slide we looked at, the what's important and the kind of 3 headline things. So there's something very important for me that we prioritise. And when I say prioritise, those 3 things, or if they're 3 things or 5 things, we're saying these are all important. But I think when you read a document, the first thing that you read on that list of this are the things, you're almost prioritising by the fact that it's in that list of an order. And I think I feel really strongly that the priorities or the outcomes that are for children and their families should be the first things that we see. So the kind of, if we're going with the right help, right time, right place, the, children, young people and families, the thing for them is the most important thing. And therefore it should be the most important thing for us as workers, as professionals, as volunteers in our communities who are helping children, young people and families. So the one around kind of better together in Oldham, that we're a family of service and support networks, that's really important. Absolutely it is. But I think that should come kind of lower down in the list and this is how we're going to do it. So the what we're going to do is improve the lives of children and families. And we're going to do it by getting better outcomes for them, by improving some of the stuff that's available for them. Improving the place that they live, so tied into kind of the regeneration. So thinking back to that kind of Leeds friendly city where it permeates everything. So that for me should be the thrust of it. We should always be starting with what's the difference for children, young people and families, and then a bit further down in that priority list, clearly there's work to do around us as professionals, as people who are passionate about children, young people and families in Oldham, but that needs to come kind of lower down for me. And then the last point to make really is just that an outcomes framework, a shared outcomes framework that is really clearly articulated, that we can all understand, and we can all understand how our bit of our contribution to children, young people and families, where it fits. And how it is making a difference. So, many of us still mourn the loss of Every Child Matters. And don't get me wrong, I feel like, there's a bit, the stuff has moved on a bit. But the thing with Every Child Matters is that everybody knew it. Everybody knew which bits they were particularly contributing towards, whether they were volunteering at the junior youth club or whether they were a social worker. They absolutely knew which bits they were contributing towards. So, a really clear framework is going to be really, really important, I think. And then the other bit, and I'll shut up then, I promise, is that there's something for me about when we're talking about outcomes, that the outcomes that are trying to be achieved should be directly about the people that they're being trying to be achieved for. So there's been quite a lot of stuff over the last maybe 8 years, particularly in a children, young people's mental health space, but not just that space, around kind of I statements So I will feel that this is better. I will see that this, written from a children, young people and families perspective. So I'd be really keen, as we've got this opportunity to kind of, you know, we've got some national frameworks which are actually quite helpful, because ultimately that's where the funding, how the funding is going to be aligned to kind of achievement of national framework outcomes. But kind of underneath that, is there something that we can do locally, which is about putting the person at the heart of what that outcome is about?
Yeah. So do you think we could rewrite the outcomes in the government one, the 10 outcomes as I statements? Do you think that would work?
I think it would be really good to speak to some, to do some engagement with children, people and their families around those kind of outcome themes, and say what would good be for you, how I would feel this, or I would be able to do that. I think that would put us on a really good starting point. Yeah.
Cool, thank you. It's really good. I'm pleased to hear Every Child Matters, having worked on it back in 2003. Yeah. but yeah, no, it's dear to my heart as well. Okay, any other thoughts on it? Did the 3 important things feel all right, or is it a bit underwhelming? In another order, obviously, but that's like the sound of underwhelming, really. Okay.
I think, sorry, Richard, I think, you know, it's a good question to pose, I think, because I think others in the room have talked about that balance between kind of, I think Steph mentioned about being really aspirational. I think Lucy's talked about being celebratory around those aspirations. And Helen, you talked about kind of aspirational but achievable and believable. And I think that's getting the balance right between those 3 things is going to be really important. I feel like there's maybe a bit to do on the themes around what's important are in a good space for me. I think there's just maybe a bit to do to kind of reflect a bit more of the ambition, but being really mindful of Helen's point around the kind of believable, achievable. So where we can get the right balance of that. So we are aspirational, but we are going to believe it, and we are going to achieve it, and young people and families are going to feel it. Yeah,
and the thing I'm trying to kind of navigate here is having a vision that kind of grasps people. And I think, you know, children, young people's views are the best thing. They're kind of experiencing things, the best thing to do that, and set out the outcomes that we want. And we can, you know, we can all do that type of stuff. But it's then to have the thing. What are the key things which will enable us to get there? What are the key sort of changes that will make the difference? And so I'm trying to get that balance between the kind of setting the aspirational outcomes and stuff, but then also really majoring on, all right, these are the things we need to do, and everyone needs to be part of doing this. So we need to work locally. We need to, you know, have this culture about how we operate together. We need to be compassionate and try and support need early. It's those types of things which trying to balance that, as well as saying, and these are the outcomes we want to achieve. And yeah, anyway, it's just that's part of my inner thinking at the moment. Okay, that's really helpful. Any other thoughts, Steph?
Just maybe if there's something somewhere along the line that says, how do we know this is working? How do we know we're going in the right direction?
Yep.
How far along the right direction? And for children and families to be able to have a hand in measuring that in some way.
So at the back end, more towards the back end, because it's a bit bureaucratic of the vision, I want a couple of things. One is actually another outcomes framework. I'm thinking of having 2, which is really bad, but anyway. But one that's the kind of the operational and the ground sort of outcomes, which we've just been talking about. And then the second one, which is kind of how we measure ourselves, which would be more for board level for kind of what do we need to, you know, be really kind of focused on, like poverty, like, you know, particular needs and things coming out of a pandemic. And I've surprised myself because I wouldn't normally do 2. So, but it feels like that fits. And then the other thing is a whole list of actions as well, which is the last question I think on the set. But it's kind of like a list of actions about, you know, what we're going to do over the next, you know, 8 years, and a kind of commitment to publishing that. So publishing both how we're doing on the needs, the outcomes, and how are we doing on the actions as well. So there is a bit of stick sort of attached to the vision, as it starts fluffy, but then sort of, you know, gets into a little bit of like, you know, let's have some grit in here as well.
I'm just reflecting kind of on what you were saying there, Steph. I think it's a really, really important point. And then I was just looking at the kind of the draft around the 3 things around what's important. And so I was at the Health and Wellbeing Board yesterday, and the conversation at the Health and Wellbeing Board is very firmly in the place of tackling health inequalities. And whilst absolutely I think the vision, we need to be ambitious, needs to be positive, I think we need to make sure that we've got an eye on some of the really stark inequalities that people face in Oldham, and particularly children face in Oldham. So totally taking your point, Lucy, around the doom and gloom if Oldham was a village of 100 children diagram. But actually, I think we can be ambitious, I think, around reducing those inequalities for our children and our families. And I might have missed it, but I feel like it probably needs to come through a little bit stronger in the language, so that we're really capturing that, because I think that's then really helpful, I think, for embedding this children's approach across everything that we do in Oldham when we're really speaking to those challenging inequalities that children and families face.
Yep. Yeah, that's good. Thank you, Laura. Any other thoughts? This is a really important part of the vision. Okay, should we try the next bit?
Okay, testing me now, Richard. Bear with me 1 second.
Slide 8. There we go. So the next section, we're just sort of talking about what will Oldham feel like for families and professionals. And we've done some work with staff and thinking through kind of how does it feel like. I've got some my statements here, yeah. So anyway, we'll see how it goes. So I've just put down some things around how it would feel like for parents and carers. Some of this is linked into the next slide. So some of this is linked into some of the national approach, and some of it's about what we think locally parents will want to be feeling, but it's obviously something we need to be testing out as well directly. But I just thought I'd share it again slightly confidentially and see what you think. So we've got I access services, drop-ins and support for my children in family hubs and other local places. And you can see here I'm trying to really emphasize kind of what does the delivery model look like? What are the enablers to that delivery model working? I get support as early as possible, so that's your early help. Sometimes even before I ask for help, feels compassionate. Feels like I'm working together with professionals, trusting and building from what I and my family can do for ourselves. So that's the systemic practice. We're connected to other families and local resources in our community. And that's a really important part of how we want the model to work. And then together with professionals we're proud of and celebrate our children's achievements. So that's reinforcing what we said earlier in the vision. So that's just the parents bit. And then if I put the professionals bit up next. So again, it's probably saying similar things, but from a different perspective, but that's how you emphasize stuff, I suppose. So I help families help themselves, feels like I'm making a difference that lasts. My work with families and other professionals is about human interactions, trusting relationships and quality conversations. I go out my way to help families. This is a really important part of how we need to be working, particularly around early help. Supported by other professionals I know, so that's the kind of team around school type stuff and things like this. And I get that support before I make a referral. So there's not a kind of like automatic see need, make a referral. There's kind of actually all need to be supporting the need that we see. My job is valued. There's a kind of workforce development aspect that I've got there, the support from line manager and partners, which is going to be really critical over the next few years. Well, it's always critical, but particularly over the next few years for retention and recruitment. And we often work in family hubs or local settings with partner agencies. And then the next slide has just got it's not something I was planning to put in the in the vision, but it's things we want to kind of bring out through the discussion, really. So that kind of relational and trusting, the friendly and compassionate, proactive, enabling families to help each other and supporting the needs you see, which are similar, but a little bit more in your face. So that was it for that question. It's kind of like, what will Oldham feel like for families, for professionals by 2030? A set of I statements really to capture that. And what do you think? What would you add in?
Shall I just say, sorry, I had to take a phone call, so I missed a little bit of the start of this. So I hope I'm not repeating anything. But in the first set of I statements, which was, that one about parents and carers, it still feels very much about a need for services and to get support from services. And I wonder if it should be about people feeling that they're doing things themselves and that the young people are going to have positive lives in the future, and it be about the families and children and young people rather than I'm working with professionals. Do you know, I don't know whether I'm articulating that very well.
Yeah, it's more a vision for how families are supported rather than what it feels like.
Yeah, and is that might be what it's supposed to be. So sorry, I missed the introduction to this.
No, it's, well, again, it's a balance. Clearly I could make a whole bunch of statements about what a family should feel and experience in Oldham, but yeah, I'm trying to emphasise, this is a vision for professionals and emphasise kind of that interaction. But yeah, it needs to be set up differently, if that's how I'm going to say it.
I'd agree with that, actually, Steph. I was thinking about it earlier, just around how we want to make sure families feel like, as part of this vision, they can do things by themselves, they can manage by themselves. So not just about professionals supporting them at that lowest level, but them being able to access help and access kind of to support their children by themselves. Do you know what I mean? To kind of sort of self-determine that. And I was thinking back to MST, actually, one of those principles around kind of trying to, almost, what we don't want is to create dependency, do we, as well, and for people to feel like they can't manage without services. So there's that, again, a balance of trying to how we put that in there and get that in there somehow.
Yeah, I agree.
Really helpful.
It's about, I guess, empowering parents, isn't it? That they feel empowered to perhaps seek that support. And it's right that they should be able to access services and engage with services. But I guess it's there when we talk about connecting to other families and local resources in the community. But yeah, I think everyone's right. I agree. It is about empowering parents as well, rather than, it almost feels like these services need to be taken to the parent, as opposed to the parent feeling empowered to, to seek the support, whether it's from a professional or other resources within the community.
Thanks, Helen. That's really good.
Yeah, I think it's a really, really important point. I think, there are a raft of families who know that they need some help and struggle to understand where they can get that help from. And there's a great example of a charity in Oldham that has become a charity in Oldham because a group of parents of kids with special educational needs and disabilities were really struggling to understand how to help their own family. And that charity's point. And, that started off with 4 or 5 families in a living room going, we just don't understand how the system works and how to kind of help our children. So I think there is absolutely something around that kind of how well stuff is connected up, so that families can find the thing that the resource or the help or it might not be a person that they need. They might just need to understand the process for something. I feel like a bit like we've kind of almost created an industry around navigating your way through a complex system to help people.
Yeah, we definitely have.
And that's something that I think we really need and want to change, isn't it? So that then actually that families that actually do need somebody and need someone alongside them through that journey of strengthening their own family, are able to do it. But the families that don't need somebody alongside them, they just need to understand what they need to do or what they can access, can just get that information and just can crack on and do it.
That model of self-help and support actually creates more sustainable change and more sustainable positive outcomes, because people have developed the skills to do it themselves.
Yeah.
I've just jotted something. Oh, sorry.
Go. After you.
I've just jotted something down around that. Like I feel like my strengths are understood, and that I'm encouraged, like, or that I can get the help myself, you know, or something about I can find that help myself wherever possible. I'm encouraged to kind of do things by myself, because I think that's one of the big principles around early help, isn't it? Is, you know, what can you do for yourself, or something around that I think would be really positive.
Thank you, Rena. That's nicely wordsmithed.
I was thinking just something as simple as, if people's own words are coming across as, you know, we want, we can, we will, and some examples of those sorts of principles, you know, people taking back a bit of power.
We'll say a bit more about that, Steph.
Just the idea that people can articulate what they want and how they want it, but also how they can and how they will pursue that. So it might be, you know, I want this information and I can share it with others, you know, as Laura's example with Point, you know, people needed that information and they got it, but now they're sharing it. Some of those same parents are sharing it with loads of people. So
yeah, okay, thank you, that's really great. Okay, anything else on this one?
I'm just changing the slide to the stuff for professionals, because I think, you know, we are part of that professional children, young people and families workforce. So just kind of, I'm just interested, sorry Richard, I've taken over facilitating the session, but I'm just kind of interested how this feels from a voluntary community faith space. How does this feel for us as members of that workforce? There's an important one for me, which is reflected here, Richard, which is the thing around kind of my work with families and other professionals is about human interactions, trusting relationships and quality conversations. So just linking over to the Poverty Truth Commission work, and that's in its kind of midpoint review. One of the really, really important themes that has come out is around kind of the experience of people with lived experience of poverty feel like the people around them to help them are not compassionate, they're stigmatized, they're judged, and that people don't understand the trauma of actually living in poverty, what that means and how that can change the way that someone interacts. So, you know, there's a real emphasis, I think, on more broadly for our workforce in Oldham, not just around children and families, but it's critical, I think, for children and families workforce, is that appreciation of how challenging and difficult it is to live in poverty, and how that impacts on you and your family and your ability even to connect with help. So I think it's really important that something that's in there, and could maybe even strengthen it around some of that feedback from the Poverty Truth Commission. Yeah,
if you've got something that's kind of, you know, condensed that I could have a read of, Laura, that'd be really helpful. It's that how do you get that empathy across in pages, and, you know, and also that tension of how do you do it without it feeling too maudlin as you're writing it as well. Thank you, that's really good.
With if no one else coming in, there's something for me around the kind of the language of the family hubs, and it's really important, I think, because that's going to be a really important development for Oldham, is the kind of the children's centres becoming those family hubs. I think I would really like to see, alongside the kind of, when we're talking about family hubs, and we've got all other local settings that we talk about, and so family hubs and other community settings. So, you know, community centres are really important. Thinking about Steph's work with OPAG and up at Grinnickers Community Centre, just kind of how important those places are to families in the community. And I'd like us to see them alongside. So it's not the family hub or that, it's kind of, they're both really important, and there's stuff happening in both those spaces that would be really good for you to connect with. It's just a semantics point, really, Richard, but I think it is important because it is about that equity around how important those more community informal networks are. They're as important, well, if not more important, is what I think we're seeing through some of the stuff. Yeah.
Yep. Good. Thank you. Okay, should we hop on to the next question? So this is a section about early help, and I'll explain a few bits and pieces as we go through it. Although I think everyone's kind of pretty familiar with this stuff. So it's just to, I don't know, it's just to kind of have a conversation really around, you know, how do we articulate early help? You know, we can't say everything in the vision, but I think early help is a really important part of what we're trying to put in place, and it's a big part of the changes we're making. And I'll explain that as we go through. So the next slide. Trying to remember what the next one is. Oh, this one. Okay, so this is the kind of the early help system. So this is a diagram I do want in the vision, because I think it shows how we're working together around families, and it shows the importance of, you know, community, voluntary faith settings, the family and friends as well, and the environment people are in, and things like that, and how critical that is to families. And there are no services involved with that. Or very few. It's about kind of what is that community around you, and how do you interact with it, and how does that build your resilience and things. Then you've got in orange, you've got universal services, which are all part of that early help model, and we know and love. And in red, we've got the acute services. So some of these, or a lot of these, dip into early help, which is why they're on this diagram as well. So just trying to show the kind of breadth of things, you know, which are wrapped around families, you know, the need for them to interact well, and, you know, do so in a district level, you know, a community level. And, you know, there are lots and lots of organisations, hundreds of sovereign organisations, tens of thousands of people, or probably 10,000 people, let's say, working in this system. And that's really who I'm trying to kind of engage with this vision. So if we go on to the next slide, there, I think this, definition. So just to say, this is the definition from government that I had a hand in writing. So early help is the total support that improves the family's resilience and outcomes, or reduces the chance of a problem getting worse. I think that some of the pushbacks being that, we need to talk about prevention, which absolutely is part of this definition, but doesn't come through as clearly as it should do. So that's kind of the definition we're trying to use, and I'll draw out prevention as well as we go through. And then on the next slide, we just got a short summary of the different bits and pieces around early help, which I don't think I'm going to put in the vision paper. It's more for the early help strategy we've been writing. But it's trying to emphasize a few things which I thought were helpful for this this workshop. So early helps everyone's business. A big one about more help for all families, and this is a really critical thing. So the whole strategy is basically, can we provide lots more help for families? Can we enable lots more help for families? Can we help families connect into the help that's available? And can we do all that earlier so that it supports families, meets their needs much earlier, feels more compassionate, and reduces the likelihood that that particular needs are going to escalate and come into more acute services where there's a lot of demand at the moment. So that's the kind of the emphasis. Big things we're doing, some of them are listed there, obviously the district delivery, family hubs, asking professionals to work on a locality basis, the community closer to families, which families have said they really want. Things like a team around the school, which are approaches designed to really build relationships between professionals and universal services, to wrap support around schools, to help them to be able to feel confident, be able to support need, as well as nurseries and GPs as well. And the community connections, the social prescribing, the community grants, which are all there to build capacity in the community, but then make sure the most vulnerable is the wrong word, but the people who need help most are able to connect into that support as well, that we're helping people to connect into the support that's available in their communities. Because I think a lot of families aren't really accessing what they could really benefit from. We Can Help Families is just a kind of simple flyery type thing to help people access things, which I'll talk about in a bit. And then there's a whole load of governance we're doing as well. The just changes which are there to, people don't need to know in a vision. God, no one needs to know about this anyway, really, but it's there to really strengthen what's going on around children's services. So we've got to provide a collaborative discussion later where we're putting forward that we need an early help alliance, which will be much more of a management board around the whole early help system, and will involve as well, we're intending to involve the voluntary community faith sectors as well in that, but it's a proper management board, not a partnership board. That's quite a different thing, but that will enable a really strong way of getting the early help system to work effectively as a whole system, rather than lots of bits and pieces doing their own thing. So is that it for those slides? I think so. So if we come out of that and have a little chat, it's just, what does early help mean to you? What should we put in the vision really around early help? How far should we go? Any other thoughts that you've got?
I mean, I'll kick us off with a comment, if that's all right. So I think do you remember the red and orange and yellow diagram around the early help system? What I'm so pleased to see in this kind of iteration of it is that at the heart of where kind of families are, there's a real acknowledgement that that friends and family networks are really important, that community is really important, that the voluntary community faith sector is really important, and alongside that kind of online self-service stuff, some of the stuff we were talking about before, where people can just get hold of the information that they need to make a difference to their family. I don't think we've necessarily in previous years of that kind of diagram, I don't think there's been that recognition around how important community, friends and family and the voluntary sector is. So I think that's a really good change and a really good step in the right direction for us, really, in acknowledging some of that. So yeah, I'm really, really pleased to see that's in there and that it's in the thinking.
Yeah, and it's a national diagram as well, so that's something that's now used across the country. Hopefully they use it anyway.
Which makes it even slightly more remarkable. Not trying to get political, Richard, but it does make it even more remarkable that it's in there. So, which it's a positive thing. It's a good thing, and I think for people on this call, for us on this call, it's about us reflecting on then what does that mean for our work? What does that mean for our charities, for our community groups? Given that it's that important, what do we need? What do we need to really kind of to push that on, really, and how can we do that? Yeah.
Just building on that in a similar way, I'm really pleased to see the recognition at the governance level as well, that the voluntary community and faith sector are recognised as part of the governance structures for this, because I think that's also something that's different and a change, and I think that's valued within Oldham is really important for all of us.
Yeah. Is it feeling all right? Kind of the early help, the way that we're describing it, is it something that feel part of? And yeah, okay, all right. This is a good section. Okay, good.
Good section. I mean, one comment, and it's more for kind of colleagues in the room, really. Just Richard you were talking about like the changes in the governance around children's work, and I think for many of us in this room would acknowledge that there has been some gaps in kind of governance around children's issues, and I know colleagues across the Oldham Partnership have felt that, and I think there's the changes in the governance and strengthening the governance is brilliant, and what it means for us in this room is that we've got to think about how do we, and it's definitely one on my top of my priority list, how do we better connect then our voluntary sector organisations and groups together to be able to inform the decisions that are taken in those governance forums, and to make sure we've got really strong strategic representation from the sector into those developing bits of governance. So I know Lucy, myself, Steph and Sarah Cook, who's not on the call today, are the current kind of voluntary sector leadership group reps into the Children's Alliance. We've had conversations together about how do we connect this up differently, and Lucy and myself were having a conversation earlier in the week, particularly around kind of some of the youth work, play work developments. How do we connect that up? But actually this is making me feel like there's quite a bit for us to do in this space. So I guess for info for colleagues, in the room that, you know, we'll be working action together, we'll be working really hard in the background to figure out how we connect all that up better, so that you feel more connected to stuff as it progresses and as it develops, really. And today's a great starting point for that.
But anyway, it says that here. But it's more sort of you know, what comes through in how we're articulating the kind of key things, and you'll see some of the themes that we've already been talking about. So obviously reducing inequality and poverty, things like co-production, co-design need to come through. Integrated commissioning less, that's more of a kind of technical thing, and so I'm leaving that sort of thing out of the vision at the moment. Investment, I hope that comes through in some of the actions that we see, but I need to work with partners to see where we can get to on that. Obviously families help themselves and more resilient, digital, relational, systemic practice, that type of stuff, and developing professional connections. And then the next section was just to kind of put up, we've got some GM principles as well, you know, whether this is helpful or not. But I haven't majored on the GM side of it. Laura, have you got the next slide? Would you be able to put that up for me, please? That's one. So I haven't majored on this because you can't do everything in a vision that you want to be short and punchy. So I haven't really majored on, you know, we're doing what GM's doing as well, and we're all connecting in, and this is the golden thread and all that stuff. But hopefully, you know, a lot of these things come through in what we're putting together, and I'm sure you could do a mapping one-to-one of all these things. So that was it really, kind of, you know, what are the sort of key principles for what we need to do. The importance of principles is that it's about, well, if you recall back, if we go to the whole room, Laura, if you think back to the diagram I did of the 10,000 people working in the early help system, and the hundreds of sovereign organisations that can do what they want, and we need to work in partnership with. There's the way that you do a transformation with that scale of system, including the 300 odd, you know, voluntary community sector organisations that are working for children and things like that, is I don't come up with a target operating model and then say, look, everyone, you've got to go and deliver this target operating model because I know what you tell me. You know, it's about, you know, what are the enablers for that system? What are the things which we really need to hold on to as a system that are important to us, that will then enable the approach and the improvement of outcomes that we're looking for. So that's what I tend to major on when I'm doing this type of thing, because quite often, you know, you're doing big transformation work, and that's why district-based working sounds like, you know, it's a sensible thing, it'll make a difference. Actually, what it does is it enables relationships to grow between professionals. And if you can get really good relationships between professionals, you can start to take down some of the process stuff that we've put in place, because that gets in the way of good working around families. It enables us to then, as professionals, know what's in the community that can help. So you get a better community connection. You start to bring resources from the community much more into supporting families and the most vulnerable families. You get those connections to work, and you know, so it's I talk about districts and family hubs and things like that because it's an enabler to a much better way of working, a much more efficient, effective way of working around families, that will have a really big impact. So you're kind of picking out key things, which if everyone focuses on these key things, actually in time the whole system should shift in the right direction. That's kind of what you're trying to do with design principles. So that's why I do talk about quite a lot about the kind of system changes, because that's the thing which will then get us the outcomes that we're looking for as well. You know, everyone can have aspirational outcomes and things, but it's getting the system into the right place so we can deliver those. So that's the important thing for me anyway. So anyway, any thoughts on design principles, or, you know, things that should come through as themes or threads that are really critical in the vision?
I'm just going to pop the design principles up there.
These are our old ones, which but they're helpful, but they're just examples really.
Okay. I mean, the thing around inequality, I think, is really important, and it points to the thing I was talking about earlier, wasn't it, around the three statements and the vision. But I think it is really important that is up front and centre for us in Oldham, and I think will help kind of align across with the developing new Oldham plan, alongside the health inequalities plan and stuff. So I think it's good to have that in there because of that synergy and the ability, the stickability that then it may well have.
Yes. Yeah, and I'm pleased about the Poverty Truth Commission and all that type of stuff. I think it really reinforces where we need to get to.
Yeah.
Laura, so I'm just wondering, we've got a new project that's starting over at Primrose, which is co-produced with some researchers from Manchester, and it is a pilot, and it's more about getting some ambassadors within the community, because some of these communities, like you said, they don't necessarily want to, or they're scared to engage with agencies. So we're looking at community ambassadors and seeing how that will build, to see whether or not what we are doing is the right fit for them to engage. Now it's in its early stages. Our first meeting is on the 1st of July, and then we've got another chill and chat on the 5th. But I'm just thinking if we can get a pattern or some from the research, that might be really good to add into this, because as I said, that community we know don't engage well with services. They're not taking up the help that's around. But is it because we're approaching it from an angle that doesn't fit them? And if it works, maybe it is something that could be rolled out in other areas as well, to see what the community itself needs. It's a project that's very much co-produced. So all being well, we'll find the fit for them, and maybe smaller projects like this would work in other bits and pieces.
Yeah, thanks.
That's excellent.
I think there's something for me. I don't know if it fits in this bit in terms of co-delivery, co-design, but I think there's also there's something around people being able to navigate the system. So as a professional, there's so many boards that you hear of, and this document, this that. There's been loads mentioned today that I've got no idea exist or what it involves. So if you're a new organisation setting up, or you're an existing organisation, if we can't navigate the system and find out what's where and what, how is a family supposed to do that in terms of systems? So I think there's something around just the whole way of how we navigate and share information and make sure it's all joined up and it's really easy to understand, because I find it really difficult as a professional to understand what fits in with what. So I think just making it really, really simple.
Me too, Lucy. You make a very, very good point, and it really comes back to that kind of accessibility of everything, doesn't it? It's yeah, and Sue, you know, we know that in some children's centres that they might be in the right community, built in exactly the right place, but actually they don't feel like they're there for the community, so people don't use them, and it's like, you know, we are missing the point. And so that's got to be a critical thing. And actually, I think it's one of the core things we're thinking about for family hubs is how can they be part of that community? How can they be owned by the community? And actually, you know, we don't need just official community family hubs. We can, you know, do drop-ins in lots of places that are part of the community and things like that. So, and we can also invite people in to the community, which is something we're trying to think about invite people into family hubs and things and online content and stuff as part of maybe antenatal classes and things, and make some changes there. It's part of the speech and language redesign that we're doing. And then on the online stuff, yeah, I completely agree. You know, I've likened much of our online content to an Excel spreadsheet. You know, it's you know, difficult to navigate. You know, it's very hard to understand what's going on. No one wants to read it. It's not inviting, which is why things like We Can Help are here, because I want to be able to, you know, at least write something that's inviting for families, that says, you know, actually we've got some stuff here which you can really access quite easily, and we can package up nicely, and you know, so yeah, it's we've got some conversations going on at the moment about putting some new resource into the website for children's services, so hopefully some new posts that can you know, try and change it so it's designed around what families want to access and understand, rather than how services have put stuff up there. There's also a big cultural shift that online information, guidance, you know, online services are a core part of what we do as services. And at the moment, I don't think we've got that cultural feel that it's important to us. Yeah, and anyway, there are lots of challenges, mostly cultural rather than technical, but we're trying to put some resource in place, and it's a massive theme of what we need to do. So you're spot on, Lucy, thank you.
I think, Lucy, your point was also speaking to, so there's something about the complexity of kind of service delivery and who does what and how, you know, to get help for a child or a young person or a family, but there's also significant complexity in the kind of partnership groups that make the do the work streams and do the work to transform some of the stuff as well.
Getting worse, sorry.
It is getting worse, and it has been in flux, I think. So, you know, there's a real job for us to do through voluntary sector leadership group and then through some of the thematic networks to better connect all that up. And I know, Lucy, you and I were having a conversation earlier in the week about how we better network the voluntary sector around children, young people and families. There's that job to do across kind of the health and social care integration, and there's definitely that job to do around kind of place-based working more generally. So there's a chunk of work that we are doing at Action Together to strengthen some of that, but it's really, really important that we figure out how we do it, that it's meaningful for people, and that we've got the right capacity to do that as well. So, you know, it's a developing thing, but it's something that we're absolutely aware of, and I know, Lucy, I'm working with yourself on that. And Steph and Sarah and others as well, particularly in the children's space. Yeah.
The reason it's getting worse is because there are three things going on. We're coming out of the pandemic, and you know, there's some rethinking about what governance we need now. You know, we've got through the pandemic, and now what comes. We've got, as Laura was saying, we've got the ICS changes, so integrated care system. So you know, moving CCGs, so clinical commissioning groups, to a whole of GM level. So there'll be one organisation called the Integrated Care Board for Greater Manchester, that is now the you know, in a weeks time, 2 weeks time, will be the you know, commissioner, the design organisation for the NHS. So that's a big change, and lots of changes, like, you know, we now statutorily have to have a system board, and, you know, various other bits and pieces that Laura and I are familiar with. And then underneath that, you've got districts. So you've got a new model of governance coming in for place-based. So I think the important things I'd draw out for children's, and this could go in the vision. I've been umming and ahhing about whether governance goes in the vision or not. But so I'll take your steer today. But the big things are there's a Children's Alliance, which is at a senior level, chaired by Gerard, and that will or does, you know, bring together. It's quite new, but it brings together the most senior people across the system for children's services. And I think is a really helpful you know, starting point. So that's where everything reports into, and then that reports to the system board and the Health and Wellbeing Board. But then underneath that, the new Early Help Alliance will be a really big thing. That will take time to develop. So we're just at the starting point of doing that. But I think that will be really important. And then on a place-based level, we've got district boards which are being developed. So there'll be some steering of what happens locally in districts, which will be a bit different to what happens across the whole of the patch. And, you know, and that autonomy will take time to grow. And there'll always be a tension between what's standardized and what you can have autonomy over. But I think the important things to kind of know about is you've got that alliance, Children's Alliance, you've got an Early Help Alliance, we'll do. You've got then the district working on the ground as well, and maybe those are the things we could pull out in the vision if that's helpful. I don't want to put dull stuff in the vision, that's all.
I think it's important it's in the vision, just so that you've got that clarity of what feeds into what.
Yeah, I think it's a really important point.
Yeah,
Lucy, and I think, you know, important to say, Richard, out of those places, those boards, those meetings you've talked about, there's only the Children's Alliance that is currently meeting. Everything else is in development, hasn't met yet. So there's a real opportunity, I think, for the sector, for us here, to kind of think about how do we bring ourselves together in a more coordinated way and connect into those right bits, which, you know, we're on with, aren't we, Lucy, and others on the call. So yeah, good.
Okay, I'll add governance in. Thank you.
Cool. So I'm slightly mindful of time. I think we're doing well. We've got about 15 minutes left on the session, and I think we've got one other area to talk through. So are you okay for us to move on to that last bit, Richard?
Yeah, of course, that'd be brilliant. Thank you.
Brilliant.
So yeah, the last question is a really easy one. It just reflects kind of, you know, starting to think in the vision, you know, what are the big things we're doing. So yeah, it was just if there are any sort of big actions you know of, what can we add in, really. And this is something where I've got a starting point, and then we'll go to various partners and ask them about those actions, but it's really commitments to improvement over the next 8-year period. And I think it's really important that we're then reporting on our commitments back to the residents to say this is how well we're achieving things. So yeah, that was that. And the last slide I'll come to in a minute, Laura, not yet.
I think one of the things that is coming through from what everyone's saying is just, I guess I feel like we have a responsibility, don't we, as people that can, make changes in the system to really involve people in Oldham and families in helping to, make the system much easier to navigate, making it clearer how the different elements fit together. Really kind of taking some responsibility for that, because I do think, sometimes the professionalism kind of takes over, doesn't it? And we kind of overcomplicate things for people, unfortunately. And I think in terms of something that would make a huge impact is, as Laura was saying earlier, getting away from almost having to employ people to navigate the system for people. Let's find a way of making it simpler, easier for people to understand, and actually have universal tools like the early help assessment, that kind of that will actually unite everyone in how we're working. So yeah, sorry, that was a bit of a garbled way of saying it, but actually I just think we need to find a way of making it simpler.
Yeah, I think you're spot on, Rena. Thank you.
I also think there's a big action around kind of, it's probably part of the design principles now I'm thinking about it, and apologies, my head's jumping all over the place, but there's something for me about really affirming the strength-based way of working. And there's different names for it, isn't there? But I think, one of the things that I think is really important across the entire system in Oldham is that we're aligning the way in which we do things and what people can expect when they need a public service. And I think, I'm going to talk for us all in the voluntary sector, if you don't mind, because I think we do it really bloody well. I remember doing some asset-based community development training, strength-based training years ago for the voluntary sector, and literally I had people in the 70s who'd volunteered for years going, but what you're talking about is just good community work, love. I'm like, well, yeah, it is. I'll be honest, it is. It's just a fancy name. Well, yeah, it is. But there's a theory behind it now. You do it because it's the right thing to do and it's the way to do it. But there's all this theory about it now, and other people are looking at it and saying this is really good practice. So I genuinely do think there's something about kind of making sure that strength-based way of working, that holistically, children live in families live in communities. It's so important that comes, that comes through really strongly. And just again, we'll just help align this alongside the rest of the kind of transformation work that's happening in Oldham.
Yeah, and there is an appetite to have a joined up approach to early help across all ages as well, which is, I think, helpful.
Music to all our ears, I'm sure.
Well, reality might take some time, but that's great.
We're staying positive, Richard. We're staying positive.
Yeah, good. If anyone thinks of any sort of actions, then do drop me a line. And Laura, feel free to share my contact details, obviously.
Sure.
Should we go on to the last slide? It's something just to share. So I talked about we can help families. This is just well, you can actually see the text a little bit. This is just when I got here, it was just really hard to navigate the systems, like you were all saying. And actually, we've got loads of stuff that can help families, which is really good. It's just people don't know about this stuff. So it's just to have something which looked all right, that looks friendly, and can help people to access. So we've got some. The aim is to get some flyers done, or probably people will just print it out on A4, frankly, and to be handing these out with families. But it's not about having a flyer that you just shoved to a family. It's about sitting down with them and saying, well, actually, based on the discussion we've just had, actually this parenting course looks really good for you. Can I take you to the web page where it is, on your phone, and let's bookmark it or get you signed up to go do a course? And I think we're completely missing that step. We're sending out information, we're putting it online, and then we think we've done the job, and we just haven't. So this is about how do we sit down with people and really take them through what can help them. Help them get onto the website, which can help them get in touch with a particular service, that type of stuff. And a bit like making every contact count, we want this to be something that every single person operating on the front line of children's services is using. And I'm sure this will iterate and improve and change. We've been looking at doing something similar around speech and language, and so there'll be one to help people through that type of thing. And in terms of navigating in the mental health strategy, we've got a whole list of things which you can access, which is a lot more detailed than the simple list that we've got here and stuff. So I think we can take that principle and apply it to a lot of different things. But I just wanted to share it with you, with colleagues, as you're working, you've got staff working on the front line, and it's something that we can share with families now. Unfortunately, the website version doesn't look quite as pretty, but it does have the same information, or it will do when I get it updated. So just wanted to share that. Any thoughts you've got on that would be really helpful. And the last thing, and again, this is slightly confidential. We been thinking about, for us to really work well together on the ground, we need to have a common identity. We need to know about what the shared what's shared between us, what's common between us as professionals across the whole system, including obviously voluntary sector, the GPs, the schools, etc., and having a shared identity would be really helpful, which is why we sort of started thinking about logos in the sort of Oldham family logo. So keen to know if anyone, what people think of the Oldham family logo. It's not official, it's just something we're trying out at the moment, but really keen whether that's kind of felt all right, and whether it might be something that in time we adopt across the system.
I like it. That's my comment.
Is that something we can start to share with families now? Or is that something that we can, you're saying that the website looks slightly different. Is that something that you've got as a PDF, or something that we can access now, that we can pass to? It's a PDF, that we can just pass that out. Yeah, no, that's great. I think it's great. Yeah,
but it's I think it's rather than just sending stuff, it's about tailoring and helping.
It's about talking to families when you're handing it to them, isn't it? Definitely.
I think bookmarking on their phone is a really good thing as well, which sounds really intrusive, but I just think we have to be really intrusive to get stuff to work through a number of different areas. It's another theme that's coming through in the stuff I'm looking at. Cool. Any other final thoughts? Obviously, I'll share my contact details, and please get in touch. If we get a draft, we'll share it as well.
Sorry, Richard, as a wash up then, as we finish, so we'll share your contact details, Richard, and then if anybody wants a conversation, I'm sure we'll be more than happy to have one. If we share the slides that you've seen today, so you can have a bit more of a detailed look at it.
Noting slightly confidential, but yes.
We promise not to share. We promise not to share it beyond kind of in this room. We have recorded this session. We do usually put our Wednesdays weeklies online, so if people weren't able to connect in, they can watch back. I usually do a bit of an editing job anyway on that. So in places where you said this is a bit confidential, a bit controversial, I'll kind of edit down so that doesn't come across, if that's okay. But we will be.
Thank you.
Sharing it on YouTube, and to be fair, the most hits we've had is about 100 hits, so it's not going to go viral, Richard. We don't need to worry necessarily about that.
I can't see it going viral, really.
But equally, I think the PDF, the We Can Help Families PDF, really helpful. I know Helen, you were interested in that, so we'll also circulate that as well to everyone here. And if that is available, it is available on the website, isn't it, as well, Richard?
And I need to have another go at getting it all online and stuff. We've got a big early help comms piece of work that we're trying to do at the moment.
Sure. But we'll send as a follow-up, we'll send kind of appropriate links around with a pack of everything from today as well, so that you've got it then, Helen, to share.
Thank you.
Excellent. Well, big thanks to Richard for coming and talking us through all that. We don't envy you the task of pulling all this together, but we're very pleased to be able to help a little bit with that. And a big
and bigger thanks to everyone else. So just really appreciate everyone's input and help, and lots of things. I'll make some changes and improve, and at some point I hope to share a draft, certainly to you, Laura. Maybe you could share with colleagues. I'll share that draft back with everybody who's been here and had some input. Excellent. Well, hope you all get to enjoy a little bit of the sunshine today. And it was great to see you all. Thanks for connecting in, and we'll be in touch soon. Okay, thanks for arranging, Laura.